Alright, so we basically just suctioned him. So now I'm going to do trach here. And basically, um, I'm going to wash my hands, putting gloves on. The bed's already raised. He's at semi-foulers. His pulse ox is kind of short, low, so I'm going to hyperoxygenate him. Alright. So we have normal saline and we also have hydrogen peroxide. Basically, I'm going to open the sterile tray. I don't forget something. And basically, I'm going to take these off. I think, oh yeah, I was wondering where
That's okay.
is this it? Okay, so this was underneath the fenestrated dressing. So I'm taking that off, and we're gonna toss that, staying away from the sterile film. And basically, we're gonna get sterile and get these goggles on. All right. All right. Let me throw these away. All right. Let's see. Make sure we can keep this sterile. Oh, this is a little a little tricky. These are really small gloves, so as a nurse, I'll make sure I have. There's only one size fits all here. So I'm making sure I don't break. Anyways, these are really small. It blacked out. Let me get them. Good. Let me figure out. So we put that one on, and now we're gonna put this one on. Making sure to keep our sterile filled. Alright, so alright. And let's so what we're gonna do is we're gonna make one hand contaminated, and we're just gonna this is a non-dominant, so basically it's all right. We're gonna pour normal saline here, and we're gonna pour normal saline in the big basin, sterile basin, and with peroxide we're gonna pour it in this one. In the big one. Alright, so basically, this is sterile. Alright. I would not have done that. That's my dirty hand. So, basically, this is my dirty hand. I would pretend I just did this. Basically, this one, it locks in place. So what we're going to do, alright, Mr. Jones, let me, take this cannula out. There you go. Good job. We're going to dip it in the solution. And then we're going to dip it. Oh, it just did. Oh, the.
You keep
Alright. It's kind of tricky, this equipment. Alright. Then we're going to clean this out. And be careful not to cross over the sterile film. We're gonna clean that out just like that, and we're gonna dip it back in there, and especially the saline, we're gonna get it all cleaned out. All right, so it's clean. So we're gonna let me get this. Oh yeah, this is sterile. Let me come around just to be on. We're gonna dry it off on the outside. Throw that to the side. Let me come around. And I'm trying to avoid using these pipe cleaners because they stick. There you go. And let's dry it out inside like that. There you go. Then we're gonna throw it to the side on the ground. All right, so we're gonna put it back in. It's gonna be a little uncomfortable. There you go. And it locks. Huh. It locks. Okay. So zero procedure done. All right. So we got that in. Okay. Let's see. Coming over, sterile fill on the ground. Oh, peroxide. Okay, so we're gonna clean up the secretions around his the neck, all right? Because he's gonna have like a lot of boogers and dried up mucus around there. So, um, well, peroxide is gonna irritate the skin. So I'm gonna put in the saline first. All right, and we just gotta be careful. I'm not crossing over to contaminate like the sterile fill. Don't want to contaminate everything. So I did not cross over at all in this. All right, so coming around. His face towards this, not no back towards it, just coming around. All right, so we're gonna go like, all right. Oh, we're gonna start at the top actually, because gravity, by way of gravity, we're gonna stop, and then we're gonna throw that out, and then we're gonna come around.
There's only two.
Okay, and then dip it in the saline solution, and then go underneath. That's gonna loosen up all those secretions. So we're gonna get that. Okay, and then I'm gonna get one more Q-tip and dip it in the saline. Oh, and peroxide, and then we're gonna clean the instrument itself because we don't want to put hydrogen peroxide on the skin itself because it'll it's very drying on the skin and it'll burn him, especially if he's just got it done. That thing blacked out on me. So I gotta hurry this up because I'm probably going over my. But just throw this out. Oh, ooh, did it stop? Oh, did it? Okay. We'll dry this out and. Oh, okay. So this is the fenestrated gauze. It's gonna have a slit in it.
One with this one.
Oh.
Is everyone?
We're having a hard time finding the gauze. Oh, you know what? Here it is. Let's just put that right there. The one with the slit in it. I didn't even know if it came with it. We're gonna put this underneath. I don't have to be sterile necessarily now. Put that underneath, and then we're gonna get him. Normally like Velcro is gonna be what we're gonna see. So just in case we don't have Velcro, we're gonna. That thing, the thing. So we're gonna move the old one down, and then we're gonna put the new one in, and then we're gonna put it through that slit. Okay. Ooh. Uh, well, it's being kind of tricky, so, and it's like going over my minute. Anyways. Okay. We tied a knot, so we're gonna come around and support his head. We're gonna come around. We're gonna come around. And then we're gonna tie it in here. Alright, so now we can get some scissors and we can cut this old dressing here. Oh, we'll cut the old tie. And there. 11 minutes, wow. Then take that off. And he's got his knee tie on, and I can take this off. And I'll address how he reacted to the procedure and make sure his pulse ox is good. If it's low, then I'll just hyper oxygenate him about maybe 2 or 3 and just kind of wait and then check his vital signs just to see how he did. Thank you, Mr. Smith. Thanks for letting me work on you. All right.